Good day, ladies and gentlemen, and everyone in between. My name is Christian John V. Jareño, together with my fellow co-researchers, Sheila de la Peña, Stephanie Flores, Alexa Hiner, and RHYLLENE Ipe. And today, we will be presenting our research entitled Factors Influencing Filipino Nurses' Decision to Pursue a Career as Clinical Instructors. The quality of healthcare in the Philippines relies on a competent nursing workforce. The Philippines faces a major nursing shortage, with many nurses going abroad or shifting as clinical instructors. Due to limited research on this transition, the study aims to support recruitment, employment retention, and nursing education to strengthen the workforce in line with the United Nations SDGs numbers 3, 4, and 8.
This study aimed to determine the factors influencing Filipino nurses' decision to pursue a career as clinical instructors.
Moving on to our methodology, our study used quantitative descriptive correlational design to determine the factors influencing Filipino nurses' decision to pursue a career as clinical instructors and explore the relationships, make predictions, generate hypotheses, study complex phenomena, and assess validity without manipulating the variables. Moreover, we also use paper pencil and Google Forms-based survey method to provide numerical data that allowed the researchers to gather prompt responses from the participants using a structured questionnaire for systematic and statistical analysis.
For the participants, the study will include Filipino nurses working as a clinical instructors, both full-time and part-time, from selected nursing schools in Bacolod City, Negros Occidental, Philippines. The study initially identified 84 participants. However, during the data gathering, 127 were recorded.
Now let's go over with the instrument. For data collection, we used a researcher-made questionnaire. It was validated by 3 validators using the good and SCATE criteria. The overall mean validity score was 4.46, interpreted as very good. The instrument has 4 parts. First is the demographic profile. The next 3 parts each contain 15 statements measuring personal factors, professional factors, and institutional factors. For reliability, we obtained the following convex alpha as shown on the screen.
Moving on to our results and discussion, the demographic profile of our participants. The majority of our participants were female, predominantly aged 41 to 65 years old, and most had over 10 years of clinical experience and academic experience, and the majority earned above 35,000 pesos.
Table 8 results align perfectly with Erik Erikson's concept of generativity, the stage where professionals feel a need to mentor those following in their footsteps. Our high score shows that nurses see teaching as the ultimate way to apply their expertise with the benefits of students, while work-life balance was the lowest rated, which tells us that nurses are moving to a classroom for an easier schedule, but for the drive to ensure the future of the nursing profession.
Table 9 shows that professional factors have a significant influence on nurses' decision to become clinical instructors. Academic qualification emerges a key factor, while compensation appears less significant. This aligns with Imogen King's goal attainment theory, which highlights the importance of achieving personal professional development. This means that nurses pursue clinical instruction as a way to fulfill their role, enhance their competencies, and support student development, reflecting goal-oriented behavior and commitment to professional growth.
Institutional factors showed a very high influence, with the main mean of 4.68 on Filipino nurses' decision to become clinical instructors. The strongest motivators were opportunities to collaborate with colleagues and supportive leadership, while research grants and scholarly opportunities had the lowest influence. This supports Imogen King's goal attainment theory through positive institutional interactions that help nurses achieve their teaching goals, and Erik Erikson's psychosocial development theory by fulfilling the generativity stage, where experienced nurses find meaning in mentoring the next generation.
The results for relationship between the personal factors and the demographic profile show that most demographic factors except salary are significantly related to personal factors, suggesting that age, sex, clinical and academic experience influence clinical instructors' motivation and perceptions. In line with Erik Erikson's theory, this reflects how life stages, roles, and identities shape career decisions and motivations. Now, for the relationship between professional factors and the demographic profile of clinical instructors, the results indicate that only clinical and academic experience significantly influence professional factors. while age, sex, and salary do not. Anchoring with Imogen King's goal attainment theory, this suggests that professional goals in nursing education are primarily achieved through experience, interaction, and role performance.
Applying Imogen King's theory of goal attainment, the significant relationships between institutional factors and sex, clinical experience, and academic experience reflect the personal system interacting with the social system. These variables serve as perceptual filters that shape a nurse's readiness for professional transactions. The non-significance of age and salary further underscores King's premise that the move toward clinical instruction is a goal-oriented progression rooted in the alignment of professional growth and institutional support.
The study examined the relationship between the factors as a whole and the demographic profile using a significance level of p less than or equal to 0.05. Age, sex, and salary range showed no significant relationship with the factors, while clinical experience and academic experience were found to have significant relationship. These results align with Imogen King's goal attainment theory, as greater clinical and academic experience enables nurses to better achieve mutual goals in the teaching environment. And with Erik Erikson's psychosocial development theory, where longer professional experience supports the generativity stage by motivating nurses to pass on knowledge to future generations.
For the conclusion, the study shows that most clinical instructors are experienced professionals, typically with over 10 years in both clinical and academic practice. Their transition into teaching is mainly influenced by professional, institutional, and personal factors, with professional growth being the strongest driver. Notably, years of experience significantly affect the decisions to pursue teaching, while age, sex, and salary do not. Becoming a clinical instructor is a deliberate and value-driven career choice, shaped by professional development, organizational support, and personal commitment.
Moving on to our recommendations. For administrators, it is recommended to strengthen professional development programs. This includes providing trainings, workshops, and continuing education to help nurse educators grow and stay competent in their roles. Institutions are encouraged to establish mentorship programs. These programs can guide experienced nurses as they transition into teaching, helping them build confidence and adjust more smoothly to academic roles. Healthcare organizations should promote supportive and well-recognized work environments. When nurses feel valued and supported, they are more likely to consider and pursue careers in academia. Clinical instructors can help by highlighting the personal fulfillment and professional growth that come with teaching. Sharing these experiences can inspire more nurses to take on educator roles. Next, nursing institutions may also offer flexible pathways for mid to late career nurses. This allows experienced nurses to transition into teaching without difficulty, making use of their valuable clinical background. For future researchers, it is recommended to expand studies across different regions and institutions. Using mixed methods or longitudinal designs can also provide deeper and more comprehensive insights. Lastly, policymakers and researchers should examine factors such as workload, work-life balance, and professional identity. These can help in creating policies that better support nurse educators.
And with that, we have come to the end of our presentation. The QR code for our references is now displayed on the screen. We would like to express our heartfelt gratitude to our Almighty God, our lecturers, facilitators, panelists, and to all who supported and contributed to this study, including the clinical instructors, as well as our families, friends, and classmates. Once again, we are 3D Group 2B, and this has been our study, Factors Influencing Filipino Nurses' Decision to Pursue a Career as Clinical Instructors. Thank you and have a good day.